While we all know smoking is, well, the dominant risk factor for lung cancer, what if there's another really powerful everyday factor, something playing a significant role in your risk
Yeah.
and even recovery? We're talking about your diet. What's on your plate?
Exactly. And today we're doing a deep dive into some really compelling new research. It's looking at how nutrition impacts lung cancer pretty profoundly.
Just from the start, like disease risk.
Yeah, from risk and how it progresses right through to patient prognosis and, quality of life. Our mission here is to uncover some perhaps surprising facts about how diet influences this thing.
Okay, let's unpack that. I saw some fascinating findings. Studies consistently showing that high-quality diets, like the Mediterranean or DASH
Now those patterns.
they're linked to something like a 15–20% lower risk of developing lung cancer. That feels big.
It is big. It's a significant protective effect. And what's truly compelling, I think, is we're not just talking about one magic superfood here.
Right, not just blueberries or something.
Yeah. No, exactly. It's these whole dietary patterns. Lots of fruits, vegetables, whole grains, healthy fats, and crucially, less red meat, processed stuff, saturated fats. Their power really seems to lie in the synergy. It's like a mix of antioxidants, fiber, anti-inflammatory compounds working together.
Creating an environment less friendly to cancer.
That's a good way to put it. It really speaks to the sustained power of just, balanced eating for prevention.
Okay, so building on those overall patterns,
Yeah.
let's zoom in a bit. Key players, specific foods or nutrients making headlines.
Yeah, for sure. Omega-3 fatty acids, for instance, the kind you get in fatty fish.
Okay.
They show pretty clear protective effects. They seem to act as anti-inflammatories, support cell repair. It's a direct contrast, actually, to saturated fats.
Which increase risk.
Right. Saturated fats often promote inflammation, cell damage, so you see that direct link.
But it's not just fats, is it? What about the other side? Foods linked to increased risk.
Good question, because conversely, the research also points fingers. Red meat, especially its heme iron.
That specific type of iron.
Yeah, it's highly bioavailable, but it can also act as a pro-oxidant. So red meat, milk, even beer have shown links to increased risk. And, it's not just single items. This is where the Dietary Inflammatory Index, or DII, comes in.
Okay, DII, what's that measure?
It's a pretty innovative tool, actually. It quantifies how your entire diet, the whole pattern, either fuels or fights inflammation in your body.
So it gives your diet an inflammation score, basically.
Kind of, yeah.
Yeah.
And what we're finding is diets that consistently promote inflammation, fan those flames, they significantly elevate lung cancer risk.
Especially for smokers.
Especially for smokers who are already vulnerable. It's like your diet is actively setting that internal environment for disease.
Wow. Okay, so diet influencing prevention is clear. But what about someone who already has lung cancer? Does nutrition still play such a key role then in their fight?
Oh, absolutely. It's absolutely crucial. If you connect this to the bigger picture, malnutrition is a really strong predictor of, poor quality of life, more complications, and ultimately reduced survival.
That makes sense. Their bodies are under huge stress.
Immense stress from the disease, from treatments like chemo or radiation. So losing weight, lacking nutrients, it can be devastating. That's why routine screening is so important.
Screening for nutritional risk.
Exactly. Using tools like the GNRI, the Geriatric Nutrition Risk Index, it's a simple but powerful way to quickly check a patient's nutritional status.
Like an early warning system.
Precisely. To identify those at higher risk of malnutrition early on.
So intervening with nutrition isn't just a nice to have, it can actually impact treatment outcomes. Can you give an example, like for someone on chemo?
Definitely. We've seen clear evidence. Targeted interventions make a real difference. Things like early enteral feeding if needed, specific oral nutritional supplements.
Like specialized drinks.
Yeah, or even focused omega-3 supplementation. These can dramatically improve nutritional status, cut down post-treatment complications, and really enhance their ability to tolerate tough therapies.
Helping them stay stronger through treatment.
Exactly. Maintaining strength, keeping the immune system robust. It helps patients stick to their treatment schedules with fewer breaks. That directly impacts their chances. It really underscores why we need personalized nutrition all the way through.
Okay, so wrapping this up.
Yeah.
What's the main message for you listening? Whether you're focused on prevention or maybe supporting someone through treatment, it sounds like your diet isn't passive. It's an active force for your lung health.
It really is. Influencing everything from your initial risk right through to resilience and recovery outcomes if cancer does develop.
Which means we need a more joined-up approach.
I think so. We need to integrate solid nutritional guidance right alongside things like smoking cessation programs and make routine nutritional screening just standard practice in cancer care, not an afterthought.
Right. Be proactive about it.
It empowers everyone and just improves care overall.
Okay, so here's a final thought to leave you with. Knowing just how profoundly your daily food choices can impact something as serious as lung cancer, its start, its journey, your body's fight. What's one small, high-quality dietary change you could maybe explore today, for yourself or maybe for someone you care about, to actively shape a healthier future?